my personal experience. About the story and experience of clinical trial and hospital care and bioethics in Taiwan, because about 30 years during my work experience, I work in the 3 areas. So I would like to share my personal experience to you from my nursing professional viewpoint. So secondly, we know the globalization of clinical trial, clinical research from the East country gradually to transfer to West country, West country transfer to East country. So you could find that the density is gradually higher than before in Eastern country. So in Taiwan, number of IND approval gradually higher than before. Include phase 1, 2, 3, 4 study, especially for phase 3 and phase 4 clinical trial in Taiwan, gradually higher than before. The volume of ongoing clinical trial in Asia Pacific region, Taiwan is the leading country in Asia. So we know about this because if conduct the PI conduct the clinical trial, the clinical research nurse is very important and necessary during the clinical trial. So from the global view, we find that the clinical research nurse professional role development from the fresh role into the mature role. You know, in American, in INH, they would like to let the clinical trial nurse to be professional role in 2010. From Taiwan aspect, we capture the clinical research nurse from 1989, and then in 2005, I was assigned to establish the clinical trial nurse training program by President Yang. He led me to training the clinical research nurse to do clinical trial. So I tried to start the credit system for clinical research training program. Until 29, after 4 years, the formal nursing education of clinical research nurse master degree course at National Taiwan University was established. So till now, about nearly 10 years, 10 years program. So the established Taiwan Academy of Clinical Research Nurse in 2011. This year we have the certification for the clinical research nurse after clinical research nurse training. So this is clinical trial nurse development in Taiwan. So I would like to say the delegation of research tasks. Some research find that nurse and data manager each contribute more than 30% of the time for the research. So physicians account for only nearly 10% of the time for the research. So we know the clinical research nurse, the job, the role is more important to give the impact for the clinical trial. So this is another literature review. The result find that measuring the contribution of clinical research nurse, many contribution from the clinical research. We know there are two important parts. The first part is the participant safety. I think nursing research participant safety and data quality. I think this is the two very important things for the professional role for clinical research nurse. So we know the competitiveness of clinical trial conduct. We know quality more than efficiency, more than cost. So clinical trials almost was conducted by industry. So industry is very focused on cost and the benefit. But we care the person, the patient, and so we would like to care the patient's safety and prevent patient suffering. So the quality of the care more than efficiency and more than cost. So why clinical research nurse is so important? Because clinical research nurse can improve the clinical trial and the quality of the clinical research. So I conducted one research about clinical research about mobile intention. We find that nearly 50% of the clinical research would like to leave their job. Why? Do you know why? There are many causes. The first cause is the compensation benefit is not expected, and the workload is too heavy. Yes. So owners is so yes. But we know nurses burn out or compassion fatigue. Yeah, because we training the clinical research nurses have the compassion for the patients, but their workloading is too heavy and then compassion fatigue. So we know among the role of the CRA's clinical research associate, clinical research coordinator, and clinical research nurse in Taiwan, we know the sponsor conduct the clinical trial, and the clinical research organization have a clinical research associate or site manager organization. They have clinical research manager to let the clinical research to conduct clinical trial. But the clinical research nurse always collect data in site, that means in hospital. So the clinical research nurse have to contact with patient and the PI and the family and the many medical staff. And the clinical trial, another role is clinical research coordinator. The research coordinator is always is the bridge between organization, PI, but they cannot to touch the patients. So sometimes the CRC and the CRN is confused or combine the two roles in one role. So it's too many work. So the workloading is increasing. So I try to clarify the role of clinical research nurse. So the third and fourth causes for the CRN why they leave their job. I think lack of professional education and training is very important causes. So I would like to our association. I'm also the president of the clinical research nurse. So I would like to try to make a clear definition and the job description for the clinical research nurse, different from clinical research coordinator. So I don't know each country, in your country, what's the difference between the two roles. Okay, so we know sometimes the clinical research nurse coordinator, he is RN or is not RN. So not all clinical research coordinator have the RN license. So they cannot to do some put IV or give the drug and the many medical behavior. So we would like to let our clinical research nurse do their professional job. So finally, we find that we survey more than 200 clinical research nurses. They conduct the clinical trial. I try to let the professional job description include 4 parts. The first one part is preclinical trial, middle clinical trial, post-clinical trial, and the professional development. These are 4 parts for training to training the clinical research nurse to develop their professional reason. So totally about nearly 200 items. So another research about I would like to improve the clinical research nurse competence. So I try to build up nursing curriculum of capacity to improve the patient's clinical research nurse competence. The research I conducted about 3 years and delay 1 year, totally 4 years. Yeah. So we would like to increase the clinical research nurse knowledge, skill, and attitude. I think the OSD is the best choice to training the clinical research nurse competence. So the Professor Yu yesterday you met her. She is my teacher. The model was developed from her a circular view on nursing system in operation. I'm a teacher, so I would like to educate clinical nurse as a good role in practice. And then she is a role model for our students to learn how to conduct a clinical trial. And then he could provide teaching research material to me or to a researcher to do some research. And we could to train cultural nursing researcher. And the research finding would to give us research result to feedback to practice to let the quality of care was improved. And then the teaching material would let us to use to educate our clinical research nurse. So these 3 O is circulation. So let's could to improve evidence-based nursing. So the nature of clinical research trial, we know research or trial means a systemic and scientific investigation designed to contribute to generate new knowledge. The term clinical is derived from the Greek. Means is to you have to go to a bed and to the physician who attend the bedridden patients. So the clinical trial means is we have to go to care the patients and in the clinical practice in the clinical. So we know why the patient would like to receive clinical trial. Most of the patients have entered to the terminal stage, or he have to receive a new drug or new medical device, or another treatment for curative. So sometimes their disease was gradually to go to bed. So he have to receive ventilator, cardiac massage, or IV infusion, hydration, nutrition, antibiotic, NG, feeding, and hydrolysis, PTCA or PTCD, and so on, many invasive instruments. So when you enter to dying process, do you want to receive futile treatment? Because every day we care patients to receive clinical trial, and we have to prolong their survival, and we have to give invasive treatment. And some conflict and have some ethical dilemma we have to face and to have to resolve it. So in the past 30 years, I work in oncology world and the bone marrow transplantation world, and I work in clinical trial, conduct a clinical trial, and 20 years ago, the dean, the vice dean, Professor Chen, yesterday you also met him. Yeah, he led me to establish hospice palliative care work. Initially, I some conflict and ethical dilemma when I care the patients during the terminal. How do they to choose their choice? I don't know. We have to give some information for the patients to respect their autonomy. So we always face the patients when he is terminal or critical. Where is the patients? Where is the patients? Many ventilator, many IV infusion, many machines. How to provide the most appropriate care for the terminal patients? So I think if you work in ICU, work in critical care ward, acute ward, I think maybe you could to face the dilemma because you every day to record some data from the machine, and maybe no time to communicate with patient. Even though you would like to communicate with the patients, but they cannot to talk because he have the trachea. He have another invasive machine. So we know in Chinese culture, the 5 blessings have descended upon one's house. When the New Year, each house we would like to have the 4 words. The 4 words is the 5 blessings. The 1, the 2, health, longevity, wealth. The final blessing, what is this? Do you know?
Good day.
Yeah, good days. Yeah, so many physicians talked with me 20 years ago. He said, Miss Wu, why do you like to pursue to development hospital care? Because this is a medical center, we have to curate the patients. Why do you let the patient to die? We have to prolong the patient's survival, not to go to die. But I think he said, I would like to let the patient to know the diagnosis, the disease. But the family and the physician don't like let the patients to know their diagnosis. So let's say if you told the patient diagnosis, the patient and helpless and powerless and depression. But I would like to say, when the patient enters to the terminal, do you perceive the patients have the hope? Have or no?
Hope.
Yes.
They still have
What's hope? What's the hope?
hope to go home, like at home,
Hope.
peacefully.
Yeah, hope to.
Not suffering. No suffering.
Yeah, no suffering, and would like to go at home, to die at home, or would like to see their friends, and to finish their wish, and so on. Many hope, many hope he would like to complete. So I think if we respect patient's wish, the hope is good days. What is the good days? I think maybe everyone is know what is the good days. Maybe by different culture. So the center of all clinical research or trial at first patients. So we have to emphasize the patient's quality of life or quality of death. So this is why I have some questions during my work experience, work period. And I would like to say if the disease treatment is useless or ineffective. And the patient would like to choose clinical trial research, or he would like to choose palliative care for good days. So I think it's some dilemma, which is the patient's choice. I remember the first day the master said the bioaccess from patient informed consents to informed choices and so on. So I think informed consent, no choice. It's just one choice, yes or no. But informed consent for the patient's choice, respect patient choice. We have to provide many choose, many different or some different treatment or direction to the patients. So I think the golden trial enroll of clinical trial, we conduct the clinical trial. We have to comply with GCP, and we have to comply with the science regulation, and we have to emphasize the bioethics or research ethics. So today I would like to say what's the nurse fundamental responsibility. This is nurse's responsibility in the world. Each country, every country is 4 components. The first is promote health. The second is prevent illness. The third is to restore health. The last is relieve patient suffering. So we know which is the most important for the terminal patients: survival, quality of life, which is important. Is it? Is really? And you say quality of life. It's your perception, it's your experience, it's your wish. But our patient maybe he would like to survive, prolong survival. So my means is that we development palliative care, provide palliative care, but not everyone, every patient she have to receive palliative care. Do you know what I mean? Yeah, because some patient he would like to prolong survival because he has the meaning of suffering. Yeah. For example, one patient received bone marrow transplantation. The mother said, the physician told the mother, you just only 5% survival to prolong survival when you receive if you receive the BMT. But the mother said, even though only 5% to prolong survival, I would like to receive a BMT. Even though I have to during endure suffering. She say he in order to let her young son, her children have the mother, I have to do my best to receive any treatment and let my son and the children have the mother. So her mother-in-law let her would like to choose to prolong survival to complete her mother-in-law's wish. So I think we have to discuss with our patients to give the patients appropriate care and respect patient choose. If it's not we feel about its best choice. So I think we provide appropriate care, not best care. Do you know what I mean? Yes. So nursing role is always have the ethical reflection. Ethical reflection, I think the training is very important. So I would like to improve clinical nurse and clinical research nurse have the sensitivity to take care of their patients. So from scientific research to palliative care in community, because in Chinese culture, our terminal patient would like to go back home or to go back their familiar place. So I would like to put nursing humanities into practice. I think it's very important. That is our workshop always emphasize this issue. So I think the core contents of nursing professional role, I would like to improve their core contents. The core contents from the BS degree, master degree, PhD degree, we would like to culture professional nurse into have an advanced role, nursing role. I think even though your knowledge, attitude, and skill was improved, but based on medical humanities. What's the medical humanities? I think caring and respect, the two components is very, very important when we training our clinical researchers or clinical staff. So I would like to say when we care the patient, he is a whole person. The whole person means the environment, have the inner environment and outer environment, include the system, inner, the person, the body have the each system, organ, tissue, cell, molecular atoms, and the quarks. I think this is so belong to biological science, physical science. This is belongs to traditional medicine scope. But the patient and the person, he lived in their familiar environment. So the social science is very important, like as family, community, subculture, belief, and human, earth, and nature. I think it's all is nursing science. So nursing science include the inner and the environment issues. There are many factors impact the patients. So we care the patient is not only physical aspect. We care the patient is the whole person, whole, biopsychosocial, spiritual care. So nursing science, we have training the nurse have the thinking ability. The whole person learning have to thinking and feeling. We say thinking destroy the beauty of feeling. Without thinking, feeling has no meaning. It's okay? It's right? So I think feeling and thinking is very important. This figure that is our Chinese culture is Dao, is the yin yang. Yeah. In my office have the symbol. Yeah. So I think I would like to say if we care the patient is the whole person. We would like to our nurse responsibility have to health promotion, prolong survival, and increase quality of life. But if the patient get the disease, and the disease, we have the curative treatment, and we give the treatment and control the disease. And we care, if we care the patient, we care the disease. So the patient suffering the pain, physical symptom or pain. And if you care the patient is whole person, the whole person is you will find that the patient he was sick, he is sick. So we will take care of the patient's psychological, social, and spiritual, and cultural domain, cultural suffering. So the patient is total suffering. So we have to provide the caring from the nurse, the nursing role. So when the patient enters to the terminal, this is the tongue cancer. The patients have this is buccal CA. So if the patients cannot to cure, so we have to provide part care or support care to increase quality of life. We have to relieve patient pain, physical symptom, psychological, social, and spiritual and cultural domain. I think the many issues during the 8 days we talk about it, the total suffering. So we would like to relieve the total suffering to improve quality of life, to assume good days. So this is why I would like to, from my nursing viewpoint, to see the patients, how to provide the caring and the respect for the patients. So the autonomy is very important. So on Saturday, we have the main issue is the autonomy of the patients. It's very, very important issue. So clinical research nurse, I think, I say many about it. We know clinical research nurse often encounter ethical dilemma in daily practice because the ethical dilemma most of come from who? Come from the PI, or sometimes come from the family. I think many. So what is an effective teaching strategy to enhance ethical reflection? I think how to capture the clinical research from novice to expert. I think to capture ethical sensitivity is very, very important. So I think yesterday we used the case-based learning by everyone from Singapore. He gave you some case to discuss about it. The brainstorming, we could identify existing idea and belief and find out relevant information and discuss and debate, promote critical thinking, and then reflection and communicate the finding to others. I think we could do training and capture the ethical sensitivity. So I got research about for 4 years. I use the case-based learning and role play discussion feedback and OC. This is the some they do role play learning activity like as yesterday activity. So the teaching strategy, I think many. I think I would like to emphasize the case-based learning. It's very, very important. So I think the time is very limited. I escaped the survey. So the case-based learning, I think, is very important. We focus on small group discussion, problem trigger of learning, and sometimes we have the scenario and the tutor facilitation is very important. And finally, the nurse, they self-directing. I think it could to increase their ethical reflection ability. So I think in summary, what is real life? I think life and living. What's different? What's different? Living have many activity. Or life
have more meaning.
have a meaningful
Yeah.
for personal.
You can be in the executive state, but you still have life.
Yeah, so
You can use life.
you are have the life or living.
Living for life.
Living just have the inspiration and expiration. But life have many thinking, many role performance. So there are some differences. So good days scale is the good days is subjective perception, not objective. So we would like to say the good days is sometimes related to the family. So but we would like to respect patient autonomy. Yeah, we have to resolve the family barrier. So Taiwanese culture, we say food comes first for people, and eating is as important as the anchor. And some I don't not become a starving soul after death. So everyone would like to eating meaning and would like needs nutrition, hydration. Yeah, but during these 8 days, we always say hydration and nutrition is not so benefit for the clinical patients. So I think have many we can talk about it. So in Taiwanese culture, medical literature, the IV fluid. So we say nutrition for the patients. The nutrition, we medical staff always emphasize the side effect, positive or negative. But the patient always experiential assessment. They always say what is her burden, his burden or benefit. It's not different. Yeah, so I think the telling the truth is also a taboo in Taiwanese culture. So how to tell the patients is very important. In Taiwanese culture, the family would like to don't tell the truth to the patients, but the patient would like to know their diagnosis. So conflict, yeah. But the nurse always face the dilemma. So this is why I do the research. I conduct one research, 500 nurse and the physician to survey what's the ethical dilemma. The first dilemma is nutrition, TPN and hydration. The second dilemma is telling the truth. So this is there are two ethical dilemma in clinical situation. So I try to resolve the dilemma. The another study I do about 3 years to resolve the family-related barrier for telling the truth for the terminal patients. So finally, I find that the dilemma is not family. The dilemma come from who? Come from physician. Yeah, because I'm so sorry to say it, because in clinical practical, we always to resolve the patient's suffering and as an advocate, as an educator for the patients. But sometimes we have a dilemma to communicate with our physician, because I think maybe the physician would like to prolong survival and give the best treatment. But nurse always would like to provide appropriate care for patients. Sometimes have some gap. Yeah, I think you have to communicate each other, mutual communication. So I think I forget the study. So the euthanasia and the natural death is different, because we know euthanasia is short of life, but the palliative care we increase the quality of life through palliative care and the natural death. We cannot short of life and not prolong the death. Do you know? Because natural day in here, but we use invasive treatment and prolong the death. So the palliative care is a natural death, not euthanasia. So I think it's very important. So I think caring is nursing is a practical hands-on job. So we would we have to give many appropriate care every day, every work. So this is our education material. Is in e-learning. We have many scenarios. We use case-based learning and through the e-learning. So about 20 more than courses to provide to our student nurse. We have the Philippine room, and so in Taiwan, Taiwan is the leading hospice care in the world. About the sixth, the rank is sixth. There are every country ranking here. Yeah, so Taiwan is the sixth in the world. In the Asia is the number one. So from 23, I do nursing education research more than 10 years. Until now, I also do some action research to capture our student nurse or nurse, clinical nurse. So this is the first day. The mentors to ask some questions about me, how to training the nurse. Yeah, there we use the entry level, professional level, special level, from A to C. From the A1, A2 is belongs to undergraduate student, and when they enter to the practicum, he is non-hospice ward, he is B1. He enter to the hospice is B2. And we would like to capture specialists for preceptor training is level C. So 5 later for the nurse training. Yeah. So the strategy, the teaching strategy, we use the patient-oriented multimedia directed interactive clinical skill technique method. We always emphasize the terminal patients is the focus. So this is the material, the video, and the textbook. The lessons of ethical reflections material is also in here. So the reflection, we very focus on what's, so what's, not what's, to let our students to think about their case. So when we have in the practicum, the patient, the student have to think about it, whether to like they from doing experience to inspire their belief, value, and attitude. Yeah. So finally, this is the students' reflectory reflection diary and the case-based learning, like as concept mapping. Yesterday you have practiced it. So yes or no? I don't know. Yesterday, I give you a poster to write many things. So and we also went to community. So we bring the students go to the home to take care of the terminal patient at the home. Many students reflection in here. So I think finally I would like to say nurse as an educator is very important. So but he has to know about what is the right patient and value-based decision model and respect patients' autonomous model. It's the three main things. So the difference between Western and Eastern principle of autonomy. For Western people, the issue of life and death are too important to be left with others, even if they are members of one's family. For Eastern people, the issue above are also too important, but to be left only with ourselves or oneself, even if one's competing. So Eastern and Western all say very important, but decided by myself or by with their family. So some different. So also they are although autonomy is like as the same word, but different meaning due to different culture. So I think the hospice home care is very important in our country. We bring the student to use development service learning, go to the community. So finally, we would like to do advanced care planning program in Taiwan. So now we try to have the guideline to let the medical staff to get more information to the patient, to share decision making with physician and family. So the nurse is an educator and a coordinator between among physician, patient, and family. So finally, I think the team conference and the family conference is very, very important. How to conduct a team conference, how to conduct family conference, has many techniques in here. So finally, we find that we have to use ethical reflection to do advanced care planning and respect patient's choice. Respect patients would like to choose clinical trial, don't lose the opportunity of survival, or respect patient choice to choose happy private care don't lose the opportunity of good death. So I think this is for my past 30 years experience, work and teaching experience to give something. So I would like to. So I think we all would like to let our terminal patients, when they are in dying, have the hope. Let life be beautiful like summer flower, and death like autumn leaves. So this is the point with Tiger. So I think make my dream come true in future for the patients. Autonomy is truly actualized in our society. So thank you.
3 years, right? How many credits for the palliative care course for the student?
For undergraduate student, 2 credits, about 36 hours. Yeah, this is interesting. Originally, 10 years ago, I first to open the courses, I put many issues in the 2 courses. I invite very famous persons, professionals to teach the students. Because our undergraduate student and the graduate student would like to would like to attend the courses. So the first year I put many things and invite famous teachers to teach them. And finally, the students said it's burden, it's fatigue. Because too many material and issue in that. So we have to depend on the student company's ability to put the appropriate material and the issue and the content in there. So gradually I decrease some content, and I invite our clinical staff to give the case-based learning. It's better than famous lecture. So this is my experience. Yeah, and then 10 years, after 10 years, it's simple, easy, and simple content, just appropriate for the undergraduate student. We prepare, they enter to the practicum. He can to face the terminal patients and communicate with the patients. And when he encounter difficult and ethical dilemma, he know who or where he could to find the resources. It's okay. Yeah.
In Chiang Mai, just only 1 hour lecture.
1 hour lecture. Oh. Yeah, initially 10 years ago we just 1 or 2 lecture. Yeah.
3 hours.
3 hours.
Yeah.
Okay. Yeah, I think the terminal patient care, the companies have to be cultured gradually, step by step. Cannot one step. Tomorrow he could be a competent nurse. So. Oh, Edward.
I'd like to ask about your field. In terms of the clinical researchers, we always have this problem of the road. So I think moving forward, what we are trying to do now is to create a role for this nurse called the nurse scientist, where the nurse scientist is really a role of a nurse come up to do scientific research work. And it's that role became very clear. Rather, while if you have your coordinating research nurse, a lot of times they became the hands maiden of all the PI, something like that stuff. So they don't have a role. So what we're trying to do now is we created a nurse scientist who totally hold controls of all the research. That he's the person who do all the research. Even though the nurses do research, but this is the master of the whole. And I don't know your house or views.
Okay. So the clinical nurse, the professional role was established 10 years ago. Because in National University is a medical center, so there are more than 2,000, 3,000 research in hospital. So there are more than 500 clinical researchers in hospital. So the President Yang say he would like to let each clinical trial have to comply IRB and GCP and so on. and meet to the scientific regulation. So we training the clinical research nurse to conduct clinical trial, pre-clinical trial, during clinical trial, post-clinical trial. Each steps have to comply with the 3 principles. So it have to be trained. So we set the program in master level, not undergraduate student, master level. So we would like to train them to be nurse, research scientist, but he also have the care role. The nursing role is care of patients, total care. So they conduct the clinical trial. They perceive the patient is the patient field of the clinical trial and withdraw the clinical trial. But the research participants cannot to express their feeling and cannot reject the PI. And the clinical research have to be an advocate to help the patients to say no and to reject the PI. So the clinical researchers always struggle and compassion fatigue. So it's very important. It's overloading, and so I would like to conduct 4 years to do job description. I would like to clarify the clinical research coordinator and the clinical research nurse. What's the job description? Because I would like to let the clinical research nurse to do professional role. So some coordination job with the PI industry, and we would like to let the clinical research coordinator to do it. The clinical research nurse just to do for the patient, for the research participant's job. Okay, yeah. It's not easy to transform from scientific role into the caring the research participant role. But the research nurse, the main goal is to protect patient safety and collect exactly good quality data. So this is the 2 important issues. Yeah. Also, the time we could to discuss after the class. I think I have to dedicate my time to my PhD student. Yeah, because I think the wound care and functional wound is very, very important. So I think that her to share. She comes from hospice care ward, so he about 8 years experience to take care terminal patients. So she would like to share some how to take care the functional wound or particle wound for you.